Okay, this is a trauma scenario. You are
Okay.
dispatched for a 22-year-old female who was struck by a vehicle in a crosswalk. It's reported that this female is lying on the ground, and let me clarify, she was struck by a vehicle. She's lying down. She's got an altered level of consciousness, and there are several bystanders helping her. That's all the dispatch information you receive.
She was struck by a car. Okay, so we're going to arrive on scene. I'm going to put on my proper PPE, gloves, mask, and an eye protection. I'm going to determine the mechanism of injury, which we've already been told is a car hitting her. So I'm expecting a pretty significant mechanism of injury, probably lower extremity. Determining that I have no more patients besides her, no one else got hit or something like that happened. I'm going to call for ALS support immediately. And then I'm going to move into my initial assessment. I'm going to introduce myself. Hey, my name's Keith. She's altered level of consciousness. So is she, where would you say she is? Can she talk to me? Is she just
Yeah.
confused?
Let me describe the scene to you. So you're at this intersection. Law enforcement has it blocked off. It was confirmed she was hit by a vehicle. Law enforcement says that, hey, she was crossing the street and this person in this SUV didn't see her and bumped into her, knocked her down, and then apparently ran her over. And so she's lying on the ground, crying in pain. She sounds confused and she sounds very anxious. And she says, what happened? Where am I? What's going on? So you do see a one bystander holding C-spine, and he tells you, am I doing it right? I don't know what I'm doing. So
Okay. I'm going to start well, when I walk up to her and talk to her, she's talking to me. So, and she's crying. So I know she's got a patent airway and she appears to be having good tidal volume because she's able to cry and talk. Um,
yes.
so I'm looking for that, and she appears to be okay there. As far as the C-spine goes, if this individual's holding it, if he's doing it okay, it depends how many people I have, but I'm going to just assume.
Let me clarify that for you. So you have one other person on your ambulance, it's an EMT, and then you also have a fire engine with three other personnel that arrive shortly after you. And they are also all EMTs. And you also have
Okay,
that
well,
paramedic in route.
I would just probably have someone else take over. I don't want a bystander necessarily stand there holding C-spine. I'm going to have my paramedic, well, it's one of the EMTs from the fire department or somebody hold C-spine.
Okay.
Um, we're going to do I'm going to look for her airway and breathing appears to be good. Circulation, I'm going to make sure she has a pulse. I'm looking for any bleeding and extenuating bleeding. We're going to check that right away. I don't want her.
Okay. You do not see any significant bleeding.
Okay. So no significant bleeding. At that point, let's see. Well, she can't, but she's altered level of consciousness, right? She's asking me what's going on. She doesn't know where she is. She doesn't know what's going on. Okay.
Yep.
22-year-old female. I guess I'm not going to assume she could possibly be pregnant, but it's a consideration. I'm going to start and at this point, she's a priority transport because of the level of consciousness and the mechanism of injury. So we're going to
Okay.
get that right away. I'm going to move, so I don't see any, I'm looking her over. I'm looking for any obvious deformities, any
Okay.
bones anything that is.
Yeah. Obvious, just quick scan of her head to toe. You see a
Yep.
hematoma on her forehead,
Okay.
and you see that her right leg is appears to be broken. It's a slightly angulated. It's red and swollen, and there's a some black tire mark going across it. Her
Ooh.
right
Okay.
leg.
So my general impression is that she's sustained a head injury. Um, she has an altered level of consciousness. That's why we're going to transport her right away. That hematoma is more of a concern to me than the broken leg because that could be some brain damage, and if she has some internal bleeding in the brain, that could be really bad. I'm going to check her eyes, see if the eyes are pearl.
Okay.
And
They actually are pearl.
okay,
A little slow to react, but pearl.
okay. So right now, since we don't have any major life threats, she's not bleeding out. She's breathing. She has a patent airway. We're gonna, like I said, we're gonna transport her as quickly as we can. I don't think I'm gonna, I don't know if I want to stay on scene to do my secondary assessment. She needs to be transported. So we'll probably do our secondary assessment en route. Um, I would get her on the ambulance right away, and we would start our secondary assessment, check her head, check for the contusion, check for any other depressed skull fractures or anything else on her head.
You
Um,
actually feel a little bit of blood in the back of her head, in her hair, and you find a small laceration that maybe needs a couple of stitches, but bleeding is controlled.
okay, so that's not a life threat to me. I mean, we could just put something back there to control bleeding. I'm going to assess her rest of her face because it sounds like that's where she, the hematoma is there. I'm going to be looking all that over, checking her jaw, checking her mandibles. I'm going to check her, then move down to her scapulas, look if there's anything broken there, look for any guarding or if she flinches at anything like that. I'm going to check her chest,
Okay.
compress it, hit the sternum, looking for anything there. I'm going to check her neck, look for any step off or crepitus there, for
Okay.
things there. I know we're holding her
So
in C-spine. We would have put her in a collar by then too.
okay, excellent.
Um,
So we'll just say C-spine is mitigated.
yeah,
You assess her neck by palpation and
yes.
don't feel anything. You assess her chest by palpation, and she doesn't wince with any pain or anything. She again says, "Where am I? What happened? Um, I'm so confused. I'm scared. What's going on?"
I'm going to be talking to her. I'm going to ask her what her name is, tell her what we're doing. We're going to be checking her spine. I don't know if I tell her she got hit by a car. I just say, where I know her level of conscious is already decreased. So I'm just going to be talking to her anyway, explaining what we're doing as we do as.
Okay.
I'm going to palpate her abdomen, let her know what I'm doing as I'm doing it,
Okay.
and looking for rigidity, distension, any guarding. If she
Okay.
was hit by a car, she could have some internal injury there, some internal bleeding. I'm looking for signs of shock. We've taken her blood pressure. We've got her pulse and her respiratory rate. I've had one of the other ones doing that, one of my other associates doing that.
All right, perfect. So let's talk about vital signs for a moment. We got
Okay.
pulse, blood pressure, respirations. What other vital signs would you want?
Like a cap refill, I would get an O2 meter on her for
Okay.
SpO2, and I would probably check her Glasgow, her blood sugar too, since she's altered level of consciousness to see what's going on
Love it.
there.
Excellent. Let me give those to you real quick. So she's got a pulse rate of 88, 88. Her
What was
respiratory
that?
rate is
What was it?
eight,
Pulse is
pulse
88.
is yes, correct.
Okay.
Her blood pressure is 128 over 90. Her respirations are 20 and non-labored. She's calmed me down ever so slightly from the scene. And then her SpO2 is 99%. And her blood glucose comes back at 103.
Okay, those all look pretty darn good.
Okay.
So her glucose is fine. Her SpO2 is good. She's breathing good. Her blood pressure is great for what she's gone through,
Okay.
and her pulse, it's a normal range.
Okay.
So I would continue with after I've got all those vitals, we're gonna continue to assess her. I'm looking for any other now. What leg did you say? Right leg.
Correct.
So right leg is broken. The lower leg or the upper leg?
It's distal to the knee and proximal to the ankle. So the shin.
Okay, so her tib fib
Hmm.
in there on the right leg. Okay. Well, I'm going to also be assessing sensory pulse and motor on bilaterally on her arms just to make sure.
Okay.
As we get down through the pelvis and stuff, I'm going to verbalize her genitalia, compress the pulse. That means the pelvic cage to make sure there was nothing there. She doesn't wince or anything. I have any breakages there. I'm
The
going to do
L is unremarkable. It's stable. No pain noted.
okay. Then I'll do the left extremity since that's the one that's not damaged. I will check CSM on both feet at that
Okay.
point.
It
Um,
is present and normal.
okay, good. Well, at that point, we would probably splint the right leg and do a splint from their ankle all the way up to the top of her femur. So
Okay.
we're splinting on both sides of the joint, and I would place her foot in a position of function. If it, we're not going to move her if I mean, if she starts screaming when we start to splint, we probably be very careful there not do that. But and we're gonna, like I said, we're gonna do this probably on the way to the hospital because of the altered level of consciousness.
Okay.
And we're just going to monitor every 5 minutes on her BP, on her vital signs, because she did have altered level of consciousness, and
Okay.
hand her off to the hospital when we get there.
Okay. So before we transfer care,
Okay.
is there anything else you'd like to do?
Well, I'd do my reassessment.
Okay. And so what would you reassess? Just verbalize that.
I'm going to see that my interventions have helped. If I put the splint on, make sure that maybe the pain is decreased. I put the bandage on the back of, there's no other bleeding, that's stopped. Talking to her more, like you said, maybe her level of consciousness is getting a little bit better. So I'm going to note that what we did and the results of those. And like I said, we didn't find any other secondary injuries from our assessment. So we're just going to concentrate on those.
So I'll tell you that she has calmed down much more. She's still in some pain, wincing in pain with that leg. Still very confused, but is able to answer questions approaprilly.
Okay, so now I'm going to start my sample history. If she can talk to me, I'm going to start saying, oh, hey, what happened? I was, whatever. Hey, do you have any allergies? Well, I'm allergic to latex, or so whatever she says, and medications. Yeah, whatever she tells me there. I
So
just what she tell me.
She has no allergies. She
Okay.
takes birth control for medications. She doesn't remember if she has any medical history. She's confused. She doesn't remember the last time she ate, and she doesn't remember the events leading up to the incident.
Wow. Okay, so she's still in a pretty altered level of consciousness. She takes birth control pills, so I guess I could consider possibly she could be pregnant. Something we have to I don't know what we do with that, but
Nothing. You can always ask.
Yeah, I would just ask her if there's any possibility of her being pregnant. But like you said, she's not allergic to nothing. She doesn't know when she last ate. I take a blood glucose level on her too, just to check that, to make sure she's within. Oh, we got that already, didn't we? 103.
Yep.
We did.
103.
Yeah, we're good.
Yep.
Okay.
Okay, perfect. You're at the hospital now, or you have rendezvoused with the paramedic. Go ahead and give me a verbal report of what's going on.
22-year-old female struck by a car in a crosswalk. Signs and symptoms were a decreased level of consciousness. Appears to have a broken tib fib on her right leg. Blood pressure was whatever. We would have taken blood pressures every 5 minutes and other things. So I would have given them what her final stats were, what interventions we did. We splinted the leg. We put a dressing over the part of her head that we didn't find any other secondary injuries based on our secondary assessment. And again, kind of talk about, she takes birth control pills and wasn't sure of her other oral intake or any other events around this. And that would have been
all right. So good job. You did the appropriate assessment. A lot of our traumas are fairly simple. They can seem complicated, but if you get much more than this, you start dealing with airway stuff, and you start dealing with some pretty significant stuff. I wanted to make this scenario enough to make you think about what's going on, but not so complicated that you couldn't handle it yourself. I would still request a paramedic for this one. So really the only thing that
I didn't call for a paramedic up front?
You did.
Oh, okay.
I would definitely get one coming. So I would have liked to see an OPQ or ST.
Oh.
And really out of that, you probably only get a good severity level. So for example, what's the patient's pain at rest versus when you move them? And so it's just a way to gauge how much pain they're actually in when things are going on. You did transport early, which I totally concur. Get them out of that environment. It's safer in your ambulance, and get them in a spot where you can, do a really good assessment. So you mitigated airway, you took vital signs, you did C-spine, you did that sample history eventually, but
Yeah.
that's okay. It's
Well, I
okay.
added my question, when they're at a decreased level of consciousness, can they, if you're just going to assume and you're asking if she doesn't know where she's at and she doesn't know what's happened to her, you're not going to really question her at that point, would you? I mean, are you just
Sure,
going to, you
sure.
would,
You're gonna engage them. You're going to try to get whatever information you can out of them.
okay,
You may get simple answers like I don't know, I don't know, I don't
okay,
know, but then they know their birthday. They know their birthday and their name, and that's enough to get to the hospital for them to look up records.
okay, okay,
So anytime you can have a patient like this, we know she has a head injury, right?
right,
And we know that she seems concussed, she's confused, not sure what else is going on. Maybe she's under the influence of something as well. Maybe her blood sugar's low, but we ruled that out.
yeah,
So it is important that when you have that patient's attention, that you gather that information as soon
okay.
as you can.
You
Yep.
know what I thought was good was when I watched the video with Gretchen said the gorilla in the corner, when you're just looking at this and you miss that because you're so focused on this, it's like, oh, you got to remember that, you know.
Yep. There's a lot to this, and you're not going to learn about everything in this remote environment. When you start running calls and you start uh, if someone starts mentoring you or precepting you and guiding you in a direction of, hey, did you see this with this patient? Or, hey, did you consider doing a blood glucose on that patient? You're like, oh, yeah, it's going to start clicking in.
Okay,
We're really just teaching you the foundation of what it takes to be in EMS. We're talking about the lingo and acronyms, and there's a lot to it. It really starts when you start running calls, which you actually have already started doing. So you have actually a little leg up, but that was a pretty good assessment. So